Hello, this is Dr. David Greene, CEO of the Nevada Pain Network. The topic today is what you need to know about fibromyalgia. What is fibromyalgia? McGill's Medical Guide calls it a connective soft tissue disease involving chronic, spontaneous, and widespread musculoskeletal pain, as well as recurrent fatigue and sleep disturbance. The condition presents multiple tender spots on the body that are primarily found on the back, neck, chest, hips, arms, and legs. Previously, fibromyalgia has had numerous names such as psychogenic rheumatism and fibrositis. How common is it? Almost 3.5% of women in the U.S. suffer from fibromyalgia, and 0.5% of men have fibromyalgia. The typical age range of those affected is between 30 and 50, and 3/4 of those with fibromyalgia actually go undiagnosed. How do you know if you have it? Well, American College of Rheumatology has come up with some guidelines. History of several areas of aches or pain for a minimum of 3 months. One needs to have at least 11 of 18 locations on the body that are significantly tender. You can see the tender points on these cartoons where you have 2 in the neck, 2 in the shoulders, 2 in the elbows, the knees, and then from the back you have them right around the shoulder blade and then through the buttock area. If it's close but one doesn't quite have fibromyalgia, the treatment is the same, but it's called myofascial pain syndrome. The Journal of the American Medical Association back in 1987 came out with its own diagnostic criteria, and there's a lot here. It's major and minor criteria. Most physicians now use the American College of Rheumatology, but these are there too. Oftentimes, fibromyalgia becomes a diagnosis of exclusion. A doctor will go through a differential diagnosis of what potentially the person has. They'll run, lab studies, imaging studies, physical exam, and if it doesn't quite fit into traditional diagnoses, then oftentimes it'll become a diagnosis of exclusion for fibro. What are the treatment options? Well, there's a lot of alternative options that have shown significant benefit. Acupuncture, chiropractic adjustments. Physical therapy is not an alternative, it's conventional. Massage treatment, aromatherapy, homeopathic medicines, spa baths, relaxing herbals, music therapy, and yoga. Now, some of the conventional options include antidepressant medications, analgesics such as NSAIDs, muscle relaxants, Tylenol, opiate medications sometimes help, membrane stabilizing medications such as Lyrica, sleeping aids, and then what you see on the right is supposed to indicate a Myers cocktail. A Myers cocktail is a collection of vitamins, minerals, and nutrients that are infused intravenously and has been shown to have benefit. There are 3 FDA-approved medications for fibro. The first was Lyrica back in 2007. Then next year was Cymbalta. And in 2009, Savella became FDA approved. We don't know how any of these actually work, but they have gone through FDA approval for fibromyalgia. How well do the treatments overall work? Well, Myers cocktail is an extremely low-risk proposition. It's an IV infusion of basically natural type substances. Small studies have shown benefit. There has not been any large studies with statistical significance, but it's becoming more and more popular because of its low risk and beneficial effects. There really is no cure for fibromyalgia, and it can be a very challenging condition. New studies are showing patients can decrease symptoms dramatically through multimodality treatment with a combination of alternative and conventional treatment options. And that's from the National Fibromyalgia Association. At Nevada Pain, they offer comprehensive pain management. So they do offer the multimodality options such as acupuncture, chiropractic, physical rehab, medication management, interventional pain treatments. There are over 50 insurances accepted. The pain doctors are all board certified. They've won the Patient's Choice Award 5 years in a row. The number to call for treatment is 702-323-0553 and visit us on the web at painmanagementlasvegas.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.